Hi, my name is Neil Ward. I'm going to do a demonstration for intramuscular injection of medication for a patient. I first come into my med room and I gather my items. I have morphine sulfate, the medication. I have alcohol pads. I have my 1 inch, 1 to 1.5 inch needle. And I have my Terumo syringe, 3 millimeters slash centimeter, cubic centimeters. I have gauze pads. I have hand sanitizer. I have my sharps container, and I have gloves ready to go. I'm going to check my order. My order is for it's for 6 milligrams of morphine sulfate. My solution is 4 milligrams per milliliter. So that's 1.5 milliliters or 1.5 milliliters to arrive at 6 milligrams. Now that I have everything sorted material-wise, I'm going to check my medications against my MAR. Here's my MAR. And I have the right patient, the right time, the right dose, the right route, the right documentation, and right patient, right med, right dose, right time, right route, right medic, right documentation. My MAR matches my orders. It matches the materials and the items I have. So now I'm going to go to the patient's room with my supplies. I'm going to provide privacy for my patient, introduce myself. Hi, Mr. Patient. I'm Neil Ward. I'm going to be your nurse today. I have an order from your doctor, a one-time order for morphine sulfate. It'll help you with your pain. It should help you lessen the pain you're feeling. I might ask them what pain level they're feeling now. They tell me 6 out of 10. That goes on my MAR that says okay to administer when above 4 out of 10 for the medication. I'm going to provide hand hygiene. And perform hand hygiene, and I'm going to put on gloves. I'm going to ask the patient what their name, their date of birth, full name and date of birth, and I'm going to compare that, what they tell me, to their wristband, as well as my MAR. So I have 3 checks, and their name and date of birth matches up. Everything is as it should be. I'm going to tell them to give an injection of morphine, an intramuscular injection. It's going to be for pain medication. I asked them if they have any allergies, known seasonal food medications. They tell me no, they're NKA. And I asked them if they have any questions. They say they don't. I will explain that morphine can cause drowsiness and it can cause constipation as typical side effects. Adverse effects could be difficulty breathing or hives if they have an allergy they did not know of to the medication. I implore the patient to let me know immediately if they experience any of these things, and we can get them taken care of. I also remind them that whenever you have an injection with a needle, there might be some tingling or burning or itchiness or like a pinch at the site. That's normal for a slight redness. That should dissipate pretty quickly. I asked them if it's okay that we proceed with the medication, and they say yes, and so we do. So I remove my current clean gloves. Perform hand hygiene. I put on another set of clean gloves, and I get my medications. So I verify my dose is going to be 1.5 milliliters. That's what I have on hand. What I'll have in my syringe. I've got the correct syringe. I've got the correct needles. So I'm going to get my medication prepared. I'm going to open my needle. First, I'm going to take my morphine, and I'm going to clean the site with an alcohol pad, the rubber stop. While that dries, I'll get my medication, my syringe ready. I'll remove my syringe, and I've got my needle. And I will take my needle and I will attach it to the syringe by screwing it in until it stops. That looks good. Now I've determined that I need 1.5 milliliters of solution. So I'm going to take 1.5 milliliters of air. And I'm going to put it, uncap the needle. Oops. And I'm going to inject the air into my morphine. And invert the bottle and draw 1.5 milliliters to give me 6 milligrams of morphine. I pull a little bit extra. I see a bubble. So I'm going to re-inject that. Get rid of my bubble and come back down to 1.5 milliliters of medication. Okay, I have 1.5 milliliters of medication, in this case morphine. I'm going to my one-handed recap. Okay, I'm going to take off these gloves again for farm hand hygiene again. I'm going to put another set of clean gloves on. I'm going to ask the patient to lie on their side. There's a few different spots we could give this, but in this case we're going to do the lower trochanter, which will be the side of their hip. I'm going to put the palm of my hand on their greater trochanter. I'm going to put my thumb towards their groin and my pointer finger at their anterior superior iliac crest. Right here. So this is going to be my spot. I'll put a little marker in by putting a pad right here. So that's my spot that I can mark as sort of a marker. I'm going to remove my hand and I'm going to take my medication. I'm going to take my cap and we're going to do this at a 90-degree angle. I've now moved my alcohol, my marker. I'm spreading the skin taut and pinch a little, and I'm going to go in straight at 90 degrees. I'm going to inject my medication slowly over 10 seconds time, starting now. I'm going to hold this for another 10 seconds. Take my needle, put it in my sharps container. I'm going to take my gauze pad. I'm just going to lay it down. Not massage, not do anything else to the site. Site looks good. And there's no bleeding at the site. It's normal. I don't have to do any cleanup. I would put a Band-Aid on if it was and clean it with alcohol. It's been 10 seconds. The medication is administered. I ask the patient if they feel any adverse effects, if they feel any pain, if they feel anything. They say they don't. It feels, nothing from the injection site is bothering them at this time. I gather my trash, I throw it away. I take my gloves off, throw them away. I clean my hands, perform hand hygiene. I document in my documentation that the right medication was given to the right patient at the right time with the right dose and the right route. And I also document the site and the site integrity of where it was. And I thank the patient for letting help. I reiterate to let me know if there's any other complications or if they have any questions. I give them their call light, and I thank them for their time and their help. And that is the end of the procedure.